Duchenne muscular dystrophy, also known as DMD, is a severe muscular dystrophy known to affect nearly all aspects of life for its affected patients. Bringing attention to this condition, PHYSCI 121 at UCLA prepares its students to understand truly what it means to live with a disease outside its prognosis. Discussing the human experience with DMD, such as the need for accessible accommodations for those with muscle weakness and difficulty walking, and managing the psychological and mental stress of such a condition. However, one glaring essential function of life has yet to be covered, and given the symptoms of DMD, it's something that most patients would find quite challenging to deal with. Today, we are going to be talking about the sexual experience of those with Duchenne muscular dystrophy with me, Connor Olsen, your favorite asexual student. I will not be bringing that up ever again. I promise. First off, we're going to take a step back and ask ourselves, what is Duchenne muscular dystrophy? Duchenne muscular dystrophy, also known as DMD, is a novel degenerative muscular dystrophy caused by a mutation of the DMD gene, eliminating a patient's ability for their cells to produce dystrophin. Commonly, through a deletion to a transcriptional site to the DMD gene, a present shift in the reading frame will be shown, thus disturbing dystrophin production. And why is this important? Dystrophin acts as a link between the extracellular matrix and the cytoskeleton, as seen right there. The dystrophin glycoprotein complex, or the DGC, is an important complex also linking from dystrophin. While still being developed, current understanding ties the function of the DGC to stabilization of muscular fibers post-contraction, protecting muscle tissue from mechanical damage as a result. However, as a result of the DMD patients containing a mutation in the genes coding for this complex and dystrophin, this function is removed, and symptoms of DMD follow due to this. This is shown best by a deletion of the 52 exon right here, in which the 52 exon is deleted in a DMD patient, causing these mutations. The common symptoms and the ones commonly restricting the active intercourse for DMD patients are products of muscle degeneration, leading to complications in movement. As fibers progressively degenerate and fibrosis starts to manifest in muscle, progressive muscle weakness represents itself in DMD patients. Difficulty in breathing and shortness of breath are also commonly results of a weakening muscular system. And if you can't move, you're going to have trouble with stamina, and there's obviously going to be trouble in the bedroom as a result. In a publication by Dr. Jess Robick, 65 DMD patients were polled for cause of concern in their life pertaining to the symptoms and experience living with the disease. First off, I'd like to mention, out of the 65 patients, 63 of them either lived at home with their parents or by themselves, with only 2 patients claiming housing with a spouse, which is a 3% estimate of the participants, a shocking decrease compared to the estimated 27% of able-bodied individuals married by age 29. On top of this, 37 of 65 patients, nearly 57%, as you can see right here, labeled sexual problems as a concern or discourse in their quality of life with DMD. In a similar study for French residents, as you can see right here, the number jumps up all the way to 80% of people not happy with their collective frustration and lack of biological necessity of sexual intercourse in their life. Another thing I want to mention is the quotes from these patients stating their lack of love in their life. I'd like to show them off here. Quote 1 would be as followed. I thought about my lack of a girlfriend for years, but I must come to terms with the fact that it is impossible. Quote number 2. I have got used to not having a girlfriend. And quote number 3. I have given up on the search for love and do no longer pay any interest to the matter. These are all things of high concern to say. So this begs the question, how can this be resolved for people with DMD? Well, this presents quite a challenge. As muscles degenerate and lose mass, DMD patients will find it increasingly harder to show range of motion, vaginal and erectile functionality, and stamina to have in sexual intercourse as a result of symptoms of this condition. As this topic is an underdeveloped research topic of DMD patients, as sexual education for those with disabilities is not currently prevalent, little aid has been given to those who can no longer do it in bed. In another study by Dr. Amana Smith, patients of muscular dystrophy detailed potential aids to use during sex, given mention to the use of hormones, pills, pumps, etc., and asked them whether they used it in the last 30 days, all as a method to increase bodily function pertaining to sex. On the right column, you see we have a sample size of 82 dystrophic patients, and The one main thing to note is that 59% of muscular dystrophy patients point to the use of lubricant specifically as an aid during sex to reduce the strain on the body, while both men and women are showing high usage of the aid in order to reduce the symptoms of dystrophy. However, as stated, the interest in such research is low, and for the most part, patients having a normal sex life is very uncommon and just not something that is super manageable at the moment. With new therapies and treatments being developed daily for muscular dystrophy, such an issue will resolve itself in due time, but we will have to be patient until that point. As humans better understand how to mitigate the effects of fibrosis and degeneration, and better retain muscle health, sexual activity can be better preserved in these patients, allowing a more fulfilling sex life. However, this is still just a waiting game, and until then, proper care must be taken to inform patients on sexual education and what a DMD diagnosis can mean for their life of satisfaction. Lists of potential aids should be provided to the parents and should be instructed on how to properly take care and talk to their children about sexual instruction. Here are some resources I found. Specifically, Canada has a really good database on sexual intercourse relationships among DMD patients and other such dystrophies. And the links to such articles will be here. The Ontario Sex Ed Clinics, which you go to in-person talk therapies, Canada's Sex Ed Pamphlet, which was detailed in the previous slide, and Walden University Disability Sex Ed, which is a 140-page note on the details of dystrophy sex education. DMD is a severe condition, but that should not be the deciding factor in the pursuit of happiness for these patients. And as much as the people do not like to talk about this or admit it, sex is a large part of that. All people, regardless of their condition, should have a chance at love, and those living with muscular dystrophy are some of the people that need to hear that the most. And I'm glad I could shed some light on this issue.